People with compromised immune systems who already got 2 doses of the Pfizer or Moderna vaccines can now get a third shot to boost their protection from COVID-19. This week's decision by federal health agencies is welcome news to many patients and their doctors who have been calling for this for months. "I'm really excited," says Pat Beale, 59, of Boise, Idaho, who lives with a liver transplant and takes medicine that suppresses his immune system. He plans to get his third dose within the next week. Data show that many immunocompromised patients, such as organ transplant recipients and others on immune-suppressing medications, have had weak responses to the initial doses of the vaccine. For Dr. Marc Boom, who runs Houston Methodist Hospital, the authorization for third shots couldn't have come soon enough for patients in his hospital's large transplant program. "We are immediately pulling in those people, getting them the doses," Boom says. He applauds the FDA's decision, but says the agency could have acted faster, noting that countries like Israel, France and the UK have already made this move. Friday's recommendations from the Centers for Disease Control and Prevention leave some questions about exactly who is eligible for an additional dose and how to get it. Here's what we know so far. Point 1. Why should immunocompromised people get a third shot? Having a compromised immune system puts you at higher risk of severe illness and death from COVID-19. Studies show that the initial vaccine doses are less effective for people with weakened immune systems, ranging from 59% to 72%, compared to 90% to 94% among people without serious immune deficiencies. People with conditions that weaken the immune system are also far more likely to have a breakthrough infection than people in more normal health. One U.S. study shows 40% to 44% of hospitalized breakthrough cases are in immunocompromised people. "If I was someone who was on one of the medications that was on the CDC list, I would almost consider myself unvaccinated at this point," says Dr. David Karp, who heads the Division of Rheumatic Diseases at UT Southwestern Medical Center. Karp says that even though the current Delta surge has mostly hit unvaccinated people, vaccinated but immunosuppressed patients are also landing in hospitals with COVID-19. For this group of patients, a third shot is going to improve their response to the vaccine and therefore lessen their chances of either contracting the disease or having a more serious disease, says Karp, who is also president of the American College of Rheumatology. For patients like Valen Keefer, who is a liver and kidney transplant recipient in California, knowing there's a way to get a third shot is a relief. "This is an amazing and such an important step and needed for a while for our transplant community," she says. "It's just been so hard to know what to do and when to do it, too."